Y'all, what if I told you that in America, you can work your whole life, pay your taxes, live responsibly, and still lose everything because you got sick? In 1990, I learned that lesson when a heart attack almost killed me, and the hospital bills definitely tried to finish the job. Last month, I met Maria from Phoenix, who's living that same nightmare right now in 2024, selling her house to pay for cancer treatment. What both of us discovered about American healthcare: it's not designed to heal you, it's designed to break you. But here's what's going to make you angry. What I paid for 3 days in the hospital in 1990, and what Maria's paying for one chemotherapy session in 2024. When you see these numbers, you'll understand why medical bills are the #1 cause of bankruptcy in America. See, we think healthcare is about medicine, doctors, and getting better. But what I learned from my experience, and what Maria's learning right now, is that American healthcare is actually about profit, insurance companies, and a system that views your sickness as their business opportunity. Let me take y'all back to March 12th, 1990. I'm 33 years old, doing comedy full-time, finally starting to make decent money. I'm performing at the Punchline in Cleveland, and right in the middle of my set, I feel this crushing pain in my chest. I try to play it off, make a joke about it. Y'all, I think my heart's trying to tell me my material ain't that good, but the pain gets worse, and I can barely breathe. They rush me to Cleveland Metro Health Medical Center. I'm scared I'm gonna die, but I'm conscious enough to ask the EMT, "Do y'all take insurance?" He looks at me like I'm crazy and says, "Man, worry about living first." So I focus on living. The doctors run tests, put me on machines, give me medications I can't pronounce. 3 days later, I'm stable, my heart's working, and I'm alive. I'm thinking, thank God for modern medicine. Then comes the bill. Y'all, when that hospital billing department handed me those papers, I thought somebody made a mistake. The total was $43,847 for 3 days. I'm looking at this bill and I'm thinking, did they operate on me with golden scalpels? Did I get medicine made from unicorn tears? But here's the thing. I had insurance through the comedy club where I was working regular gigs. I thought I was covered. Turns out my insurance covered $12,000. The remaining $31,847 was my responsibility. $31,000. I didn't have $3,100, let alone $31,000. I go to the billing office trying to explain my situation. The woman behind the desk, her nameplate says Karen, looks at me with the warmth of a January morning in Alaska and says, "Mr. Harvey, you received excellent care. Now you need to pay for it." "Ma'am," I say, "I don't have this kind of money. Can we work out a payment plan?" "We can set up payments," she says, "but you'll need to pay at least $500 a month plus interest." $500 a month? That was more than my rent, more than my car payment, more than what I spent on food. For the next 2 years, I paid that hospital $500 a month, $6,000 a year for a 3-day stay. And because of the interest, I still owed them $18,000 when I finally had enough money to pay it off in full. That heart attack cost me more than my health. It cost me my financial future for years. Now fast forward to last month, I'm in Phoenix doing a corporate event about overcoming adversity. And during the meet and greet, this woman approaches me. She's got a beautiful smile, but I can see the worry in her eyes. "Mr. Harvey," she says, "I need to ask you about fighting a system that seems designed to destroy you because I think I'm losing that fight." Her name is Maria Gonzalez. She's 52 years old, works as a high school counselor, been married to her husband Carlos for 25 years. They've got 2 kids in college and a modest house in Tempe that they've been paying on for 15 years. "Mr. Harvey," Maria tells me, "6 months ago, I got the call that changes your whole life. My doctor said I had breast cancer." Maria describes going through the same fear I experienced. Not just the fear of dying, but the immediate worry about cost. Even with insurance through her school district job, she knew cancer treatment was expensive. "My insurance is supposed to cover 80% after I meet my deductible," Maria says. "Sounds good, right? Except my deductible is $6,000 and 20% of cancer treatment costs." Well, let me tell you about my first chemotherapy session. Maria shows me the bill on her phone. One chemotherapy treatment, $18,400. Her insurance covered $14,720. Her portion, $3,680. "That's for one session," Maria says. "I need 12 sessions, plus radiation, plus surgery, plus follow-up care." Maria does the math for me. Her total treatment cost is projected at $340,000. After insurance, her portion is $68,000. Harvey, she says, I'm a school counselor. My husband works at Home Depot. We don't have $68,000. We don't have $20,000. We barely have $2,000 in savings. Maria tells me about the choices she's had to make. First, she tried to get a payment plan with the hospital. They offered her $1,200 a month for 6 years. $1,200 a month, Maria says. That's more than our house payment, more than our car payments combined. When she couldn't afford the payment plan, the hospital suggested she apply for charity care. But to qualify, her family would have to make less than $35,000 a year. As a school counselor and with Carlos working full-time, they make $67,000. Too rich for charity care, too poor for cancer, Maria says. That's what Carlos calls it. So Maria and Carlos made the hardest decision of their lives. They're selling their house. We've lived in that house for 15 years, Maria tells me. It's where we raised our kids, where we plan to retire. But it's the only way I can afford to live. The house will sell for about $280,000. After paying off their mortgage, they'll have about $95,000. That'll cover her treatment costs, but they'll have to rent an apartment and start over financially at 52 years old. The worst part, Maria says, is that I'm one of the lucky ones. I have insurance, I have a house to sell. There are people getting the same diagnosis with no insurance and no assets. What happens to them? Now, let me tell you what I told Maria and what both of our experiences reveal about the American healthcare system. See, what Maria and I both discovered is that healthcare in America isn't really about healthcare. It's about wealth care. The system is designed to extract maximum profit from human suffering. In 1990, my 3-day hospital stay cost $43,847. Adjusted for inflation, that would be about $95,000 in today's money. But Maria's cancer treatment costs $340,000. Healthcare costs have grown 3 times faster than inflation. Here's why. In most countries, healthcare is treated as a public service, like fire departments or schools. In America, healthcare is treated as a business opportunity. Maria's one chemotherapy session costs $18,400. That same treatment in France costs $3,200. In Germany, $4,100. In Canada, $2,800. Same medicine, same procedure, but in America, someone's making $15,000 profit on Maria's cancer. Both Maria and I learned that the phrase world's best healthcare is marketing, not medicine. We don't have the best outcomes. We just have the most expensive treatment. But here's what really makes me angry. The system is designed to make you choose between health and wealth, between treatment and financial security, between living and bankrupting your family. Maria shouldn't have to sell her house to treat her cancer. I shouldn't have had to pay $31,000 for 3 days of care. But in America, your access to health care is determined by your access to wealth. Y'all want to know what's happened since Maria and I connected over our shared healthcare trauma? Maria's story isn't unique, it's universal. She started a support group for cancer patients dealing with financial toxicity. Every week, 15 to 20 people share stories identical to hers. Good insurance, good jobs, but bankrupted by medical bills. Through that support group, Maria learned about patient advocacy organizations, hospital billing error audits, and pharmaceutical assistance programs. She reduced her out-of-pocket costs by $23,000 just by knowing how to navigate the system. But here's what Maria realized. Individual solutions aren't enough when the problem is systemic. Maria became an activist. She testified before the Arizona State Legislature about medical debt. She organized healthcare affordability rallies. She turned her personal crisis into a public campaign. And me, after my heart attack bills, I started asking different questions. Not how can I pay these bills, but why do these bills exist in the first place? I learned that other countries don't have medical bankruptcies because they don't tie healthcare access to employment and wealth. They treat healthcare like we treat public education, as a right, not a privilege. Both Maria and I realized that sharing our stories wasn't just therapy, it was activism. Every time someone hears about medical bankruptcy, they understand that healthcare reform isn't political theory, it's survival necessity. Maria's house sold last month. She's now living in a 2-bedroom apartment, but her cancer treatment is covered. More importantly, she's using her experience to help other families avoid the same choice. So here's your homework, and this is for everyone who's ever worried about the cost of getting sick. First, understand that medical debt is not normal in most of the world. American healthcare costs are uniquely expensive because our system is uniquely profit-driven. Second, know your rights. Hospital billing errors happen in 80% of bills over $10,000. You can request itemized bills, negotiate costs, and apply for charity care even if you think you don't qualify. Third, don't face medical debt alone. Organizations like RIP Medical Debt, $4, and Patient Advocate Foundation provide free assistance with medical bills and insurance disputes. Fourth, support healthcare reform candidates and initiatives. This isn't about politics, it's about survival. Vote for people who understand that healthcare is a human right, not a business opportunity. Fifth, share your story. Medical debt thrives in shame and silence. The more people understand that healthcare bankruptcy happens to responsible, insured, working people, the more pressure there is for change. If you're dealing with medical debt right now, remember what Maria taught me. You are not responsible for a broken system, but you can be part of fixing it. Your illness is not your fault. Your medical bills are not your moral failure. Your struggle with healthcare costs is not a personal problem. It's a systemic crisis affecting 530,000 American families every year. Maria learned what I learned 34 years ago. Sometimes the medicine that heals you is fighting for a system that doesn't make you choose between health and wealth. We both discovered that the most radical act in American healthcare is expecting to receive treatment without going bankrupt. The most revolutionary thing you can do is demand that healthcare serve people instead of profit. Your health matters more than their wealth. Your life is worth more than their business model. And your story, combined with Maria's story, combined with millions of other stories, is what changes systems. Y'all remember that individual healing requires individual treatment, but systemic healing requires systemic change. Don't just survive American healthcare. Help fix it for the people coming behind you. Because in a truly healthy society, getting sick shouldn't make you broke, and getting better shouldn't cost you everything.